is Paget's disease? Paget's disease, or known as osteitis deformans, is defined as a significant increase in bone turnover and resorption in some specific areas of bone, which lead to disorder and unstable bone growth and thickening. As we know, in healthy bone, there is a process known as remodeling, which will remove any old bone fragments and replace them with the new one. However, this process becomes out of balance due to Paget's disease, producing new bone that is misshapen, weak, and brittle. There is two types of Paget's disease. The first one is monostoty, which affected single side of the bone, and the other one is polyostoty, which affected multiple sides of the bone. For incidence and prevalence, Paget's disease is most prevalent in Western Europe and United Kingdom, but also prevalent among British immigrants to Australia, New Zealand, South Africa, and South America. This disease is uncommon in Africa, Scandinavia, China, Japan, Southeast Asia, and also the Indian subcontinent. It is rare to see the Paget's disease occurs in an individual who is under 50 years old, as the prevalence increases with the age. This disease commonly occurs in men rather than in women, and in Malaysia there is 2 rare cases reported involving scrotal area and vulva. For etiology, it is actually uncertain, but there is some that may be the cause. The first one is genetics. It is said to be run in families. According to some studies, close relatives of people with Paget's disease of bone are 7 to 10 times more likely to get the disease compared to people who do not have an affected relative. The second one is infection. This disease possibly due to the infection by measles virus during childhood. It also linked to genetic mutations like SQS-TM1, which plays important role in bone remodeling. This is some clinical features of Paget's disease. Most people are not aware of having Paget's disease, as they might think that the symptoms that they're going through is just another bone disorder like arthritis. The most common complaint is bone and joint pain, specifically at the back, knee, and hip. Headache and hearing loss also can occur due to the overgrowth bone of the skull. Next is heat pain when the Paget's disease affect the pelvis. There will also redness of the skins that cover the affected areas. Lastly, nerve compression, which can cause the feeling of pain, tingling, and numbness in the arm or leg. For the physical clinical features, the head size will increase, where there will be an enlargement of the skull, causing the forehead area to be large. And then the leg will be large and shaped irregularly, or we call as bow leg.
Paget's disease occurs when there's an increase in bone resorption that leads to a decrease in bone mass and lytic structures. This process gives rise to osteoblasts from the bone, utilizing a sensing system that allows them to increase their activity. The first lesion is thought to be caused by a localized increase in osteoclastic bone resorption. This is followed by a rapid increase in bone production. New collagen fibers are put down in a disordered way rather than in an orderly linear pattern. The resulting bone is a woven and lamellar mosaic that is mechanically inadequate and prone to fracture or deformation. Enhanced expression and signaling of interleukin-6 may lead to increased osteoclastic activity. Bisphosphonates are quite effective at lowering the elevated bone turnover seen in active Paget's disease. Bisphosphonates achieve a 50.1% higher decrease in total ALP than placebo, according to a Cochrane study, and the RR of bisphosphonates normalizing total ALP was 9.96. No higher effect on quality of life, bone pain, deafness, fracture rates, or the need of orthopedic surgery than symptomatic therapy.
For prognosis, the patient who have been treated will have a good prognosis, especially if the disease is in its early stages. And there is no cure, but if do treatment, it can slow down the symptoms.
For impairment and functional limitations, if the Paget's disease affects facial bone, the patient will have difficulty in chewing or eating, and if the Paget's disease affects lower limbs like tibia or femur, it will affect locomotion or having mobility problem.